Physical assaults and workplace violence can take on many forms, from being grabbed or kicked all the way up to homicide. It is equally important to recognize the non-physical forms of workplace violence, which can happen in a variety of ways, including text and email. This type of workplace violence can be psychologically damaging and may be a precursor to physical violence. Workplace violence can happen anywhere you perform work-related duties, but there are certain areas which are more vulnerable than others when it comes to assaults. A wide variety of people are in and out of our facilities each day. It is important to recognize that everyone has the potential to be either a victim or a perpetrator of workplace violence. We recognize that workplace violence is increasing in healthcare. That is why we have developed several approaches which can be used to combat this growing epidemic. Methods of combating workplace violence using our H3W behaviors. MCMR escalation management training, being situationally aware, recognizing signs of escalation, utilizing de-escalation techniques, the 3 Ds after a workplace violence event. Our patients are oftentimes in pain, anxious, scared, and desperate, and our visitors may be coming to see someone they care about who is suffering or possibly dying. Long wait times, the cost of medical bills, and an unknown diagnosis only adds to an already stressful situation. Remembering to leverage and respect these separate realities is a great first step in preventing violence. Being in the moment, actively listening, and showing empathy can greatly reduce the chances of a workplace violence incident. Some patients who enter healthcare facilities are experiencing an altered mental status, which may be attributed to an illness or substance intoxication. These patients may be angry, depressed, in crisis, delusional, or emotionally dysregulated, and communication may just not be possible. Recognizing when communication is not an option will prepare you for the next steps in providing treatment, which may require you to seek assistance from colleagues and public safety. No other skill is more important than being situationally aware when it comes to safety. It is a conscious effort to continually scan your environment and the people in it. It requires you to be in the moment. Pay attention to your surroundings using all your senses and avoid distractions. Being situationally aware will help you to identify exits and escape routes, recognize signs of escalation, alert you to signs of an impending attack, and pre-plan your exit strategy if necessary. Constantly monitor a person's body language for signs of escalation. This can include subtle signs like sweating, tightening of the jaw muscles, fluctuations in tone, or rapid breathing. Some more obvious gestures that a person is escalating include clenched fists, pacing, yelling, finger pointing, and swearing. Once you observe signs of escalation, you should immediately create distance from the person. Move closer to your exit, keep your hands free and at chest level, and begin de-escalation attempts if the person is communicative. Remember to keep your emotions in check. Keep your voice soft and low. Do not engage in arguments or make threats, and avoid confrontational body language such as finger pointing or crossed arms. If you feel yourself starting to escalate, it is okay to have a colleague step in and take over. If de-escalation is not working and the person continues to escalate, you need to alert colleagues and public safety immediately and prepare to evacuate the area if necessary. Although patient care is a priority, your safety comes first. You cannot care for someone if you are injured by an assault. Being assaulted is not part of your job. Being in close proximity, turning your back, or presenting an easy target for someone to strike could result in an attack. Creating distance at the first sign of escalation and keeping that pathway to your exit close and clear will help you in avoiding a physical assault. Watch for some common signs of an impending attack, such as looking around, adjusting clothing, taking up a fighting stance, target glancing, or verbally threatening to attack. If you are assaulted, you need to leave the area immediately and seek medical attention. Yell for help if necessary to alert nearby colleagues, and call for public safety to intervene. Do not attempt to strike the person back. That will only result in more physical violence. Your goal is to get away to a safe area and get help. Familiarize yourself with safety features in your location. Connecticut law provides specific protections to healthcare workers when it comes to assaultive behavior. If you are a victim of an assault, you make the decision on whether to press charges or not. Being assaulted is not part of your job, and holding people accountable for their actions sends a message that their behavior will not be tolerated. It also may prevent the next healthcare worker from being assaulted. Public safety can assist in being a liaison with law enforcement and help you through the process. Most cases never see a jury trial, so you will likely not have to appear in court. You can use your work address and email as contact information in the report. Do not use your home address. After the incident, you want to remember the 3 Ds: document, debrief, and decompress. It is important that all instances of workplace violence are properly documented, whether it is physical violence or threatening behavior. Creating a record of the incident through our internal reporting system allows us to collect statistics which we can use to identify trends and formulate better training. Public safety can also document in the report writing system and flag patients or visitors who have a history of violent behavior so staff can be better prepared when treating them. You can also send an email to compliance. Debriefing with colleagues, supervisors, and public safety will allow everyone involved to discuss in detail what happened. Look for any possible safety issues that may have contributed to the event, and talk about what could have been done better. Debriefing allows a situation to be analyzed for future improvement and lets colleagues reflect on their participation in the event. As healthcare professionals, we are exceptionally good at taking care of other people. When it comes to caring for ourselves, we tend to be much less understanding. Caring for yourself is where our 3rd D comes in: decompression. Sometimes signs and symptoms of distress are easy to see in yourself and others. Things like irritability, decreased concentration, crying, sweating, or pacing. Others, however, are more difficult to pick up on. The internal or invisible signs of distress include things like rapid heart rate, intrusive thoughts, playing the event over and over again in your mind, changes in sleep or appetite, muscle tension, and many more. Here is a quick and easy guide to assessing where you are emotionally and tips for how to care for yourself at every level. It's important to understand how we are really doing so that we can get the right supports in place and start feeling better. Identify supports and activities that help lift our mood. Treat yourself the way you would treat a good friend who is struggling. Try to focus on meeting your basic needs, like eating and sleeping enough. Celebrate the small victories. Engaging in self-care is very important. The most informal support resource here at Hartford HealthCare is our peer support program. Peer support is not formal counseling and is free and confidential. Next is Guidance Resources, our employee assistance program which offers crisis support, formal counseling, and much more. The Well-Being Department is always here and ready to have a conversation and help support you in any way that feels helpful. Whether you are looking for guidance on where to start, need information on resources, or just want to talk through a situation, you can always reach out to us. Hartford HealthCare is committed to helping our colleagues recognize, combat, and cope with the reality of workplace violence. Because being assaulted, harassed, or threatened is not part of your job. Staying situationally aware, watching for signs of escalation, utilizing de-escalation techniques, and avoiding situations that could potentially result in physical violence will assist you in staying safe. If you are a victim of workplace violence, remember to utilize the 3 Ds: document, debrief, and decompress. Because your safety matters.